हेलो 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 हेलो। Good evening, everyone. Good evening, everyone.
Good evening, sir.
We have Dr. Puneet Nagendra. He is the respiratory physician. He will be our chairperson today, and he is associated with our organization and give little bit more details in few minutes. And also we have Dr. Prashant sir, today's speaker. So both of them are already online. And since some people may prefer to attend through YouTube transmission, and some people may attend through Zoom. And also people will start joining very soon. Generally we keep the meeting like the starting time at 6 p.m. So ensuring that to ensure that the meeting starts exactly at 6 o'clock, especially presentation, topic presentation. I wanted to finish off the formalities of introduction of speaker and chairperson and about the society and everything as early as possible, so that we are able to start the remaining activities on time. So with this background, I would like to go ahead with the introduction of speaker and like introduction of the chairperson. And chairperson will introduce the speaker and also introduce the topic, and then we'll go ahead with the today's presentation. Let me just first introduce our chairperson. Okay. So good evening, everyone. We are very happy to have Dr. Puneet K. Nagendra. He is my very good friend, and we have been associated with each other since last 6 years. And I'm very happy that I came across Dr. Puneet and as my colleague 6 years back, and he's a very nice gentleman, most importantly, and also a very good clinician and a very versatile personality, and very accommodative person. With all these, like finding one person with all the qualities is, sometimes it is difficult. And so I'm very fortunate to have him as my colleague and a very good friend. And let me just, introduce about his professional achievements and career details. He is currently working with us in CDCIMR, that's the Chandrama Dayanand Sagar Institute of Medical Education and Research, Devar Kaggalahalli, Narapalli, Bangalore. It is coming under the Dayanand Sagar University. So he is currently working with us as a consultant pharmacologist and is associate professor, associate professor pulmonologist, and he is also consultant at the Bangalore Allergy Center. And as I told you, he is our associate professor in the Department of Respiratory Medicine, and he is also founder director at BACME Counseling Academy, and he is a trustee at Bangalore Allergy Foundation. And giving a little bit more details about Dr. Puneet. So he's a specialist in respiratory allergy and also pulmonary medicine. He currently, as I told you, he is associated with Bangalore Allergy Center and also CDCIMR under Dayanand Sagar University. He brings a rich clinical experience from institutions like Sri Ramachandra Medical College, Bhagwan Mahavir Jain Hospital, John Muir Medical Center, USA. He is trained in integrated disease management by S. Vyasa University and holds an RGHS fellowship in allergy and allergen specific immunotherapy. Additionally, he has expertise in palliative care. Through Palladium India, he got certified, and also he is expert in counseling. He got trained under Banjara Academy. As executive director at BACME, he trains future medical counselors and he organizes webinars on pulmonary medicine through platforms like Karnataka Pulmonologist Association and also BACME. His research focuses on clinical trials in Bluetooth stethoscope, herbal preparations for antitubercular treatment, induced hepatotoxicity, AI for MDR, tuberculosis detection, cancer screening via breath analysis, and improving allergen immunotherapy compliance. So now I would like to request Dr. Puneet to introduce the topic and also introduce our uh, speaker for today. Yeah, Dr. Puneet, can you hear me? I think now your phone is unmute. You have to unmute. Please unmute yourself. Yeah.
Thank you very much, sir. It is such a beautiful occasion to join this forum because it is such a topic which is dear to my heart. I could not say no because Mondays are very busy for me, so I had to accept this because of the title as well as because of the speaker. So I would like to introduce for the benefit of the audience. Dr. Prashant Bokarkar is professor and head department of Rasa Shastra in Nagpur, DMAMCHRC. He is completed his MD Ayurveda in Rasa Shastra and Government Medical College Nanded, and he has an over 2 decades of academic and research excellence. He has dedicated Ayurvedic pharmaceutical sciences since 2005, and he has been mentoring aspiring Ayurvedic scholars and practitioners. He has an industry experience in Dabur India Limited and Arya Vaidya Pharmacy, and gained extensive experience in the operations and R&D in these companies. He is a prolific researcher with multiple national and international publications. Sir has also published in many index journals of repute. He is the principal investigator on several funded research projects. He has organized numerous seminars, workshops, and training programs, and actively promotes pharmaceutical advancements in Ayurveda. He encourages integration of traditional and modern medical sciences. This is where is the interesting part, and we would like to collaborate post this lecture. And he has an international recognition and invited speaker at global conferences in Spain, France, Italy, and Dubai. He bridges the gap between ancient Ayurvedic wisdom and modern scientific innovation. So, very glad to have you for this topic, sir. And without much of delay, we would like to hear from you.
Maybe I would like to maybe Dr. Puneet, if you can talk a little bit because you are the physician. Maybe we would like to start exactly at 6 o'clock. So you will have another 4 minutes. Maybe if you want to give a little bit your expertise on asthma and integrated medicine. So maybe you can spend 4 minutes. After that, we'll start the program.
Sure, sir. So, thanks for this extra 4 minutes time. This topic, as we are all aware, exploring Ayurvedic drugs and bronchial asthma. I'm sure the audience will also be a mix, and the majority will be from the pharmacology background. So we have all understood what asthma is, and there are biologicals which are also used for the treatment of asthma. Now, the issue with asthma is we have not found out any specific reason. We don't have a specific etiology as well. It is a multifactorial airway involvement, and there are multiple biological markers. We don't have a single biological marker. This all, with all this background, we know asthma is something which has to be multifactorial in even during treatment. Interestingly, about 4 months ago, I had one PhD scholar who is a basically Ayurveda physician, who wanted to do a trial in asthma, a drug used in Ayurveda and in a nebulization form. I was very keen to initiate this study, but unfortunately, she had multiple issues with the formulation, multiple ethical issues, and other things. I was very keen to take up this project because what nebulizations and inhaled medications we have, they have their own side effects, and they're short-lived. Basically, they're short-lived. So I was thinking if Ayurvedic preparation would give a better thing, I was very keen about it. But since it's a PhD thing for her, we could not go ahead with that particular preparation. But then I was really surprised that even Ayurveda has a formulation which can be delivered through a nebulization. So that is the kind of information I have. So probably Dr. Prashant sir might give much more insight into the formulations available for in the Ayurveda. And we also are aware that the latest medications for asthma has been the biologicals. The biologicals have come up with the recent advances in the technology and even in the formulation. But we are also aware that we are having so many gray areas related to its long-term adverse events and also its dosage. And of course, it is the cost efficiency when it comes to the patient usage. So here is where we are limited. Again, we have been using many inhaled medications, which are giving definitely, which are giving quite a bit control, and also very useful in patients who are having seasonal asthma. But the subset of asthmatics who are having chronic disease, not giving better results with the routine inhaled corticosteroids and medications, we need to find an alternative. So let's see if our speaker has to give anything more, which can also act as an adjunct therapy, or it may act as a new alternative therapy. Thank you, sir.
Okay, thank you so much, Dr. Puneet. This was really nice. Now, again, I'll come back to you in a short period of time so that we can again discuss more on the these aspects what you just raised. Now, Dr. Prashant, this is your stage. Please go ahead, and I'll be here to help you to uh, share the slides. Hope all of you are able to see the slides. Any difficulty, please, let me know. Hope you are able to see the slides. Can anyone confirm?
Yes, sir. Yes, sir.
Okay, super. Thank you
Yes,
so
sir.
much. Dr. Prashant, so please go ahead with the topic. Then we'll come back again
Thank
for
you.
the question and answer. I'll assist you in changing the slides. Please let me know when I need to change the slides. Thank you.
Yeah. Sure, sir. Thank you very much, sir. Myself, Dr. Prashant, and first of all, I would like to make the thank to Dr. Murthy, sir, and today's chairman, Dr. Puneet, sir. Thank you very much for introducing me. So today's topic is the exploring Ayurvedic drugs in bronchial asthma and integrative approach. Next one, sir. So first of all, I would like to make some impression that there is a disclaimer. The presentation is a collection of previous slides, sir. The presentation is a collection of internet material. Author doesn't claim any copyright, personal opinion. The presentation is up to upgradation of medical knowledge and use for the betterment of mankind. Next one. So, in the current era and in the advanced era of this modern medicine, there should be some highlight that asthma is having the role in Ayurveda. Next one. So this is the brief that introduction to asthma, conventional treatment approaches, introduction to Ayurveda, Ayurvedic diagnosis and treatment of the asthma, how we are just making the diagnosis of Ayurveda by using Ayurvedic tools and Ayurvedic methodology and principles. The herbal remedies used in the asthma management and role of lifestyle and yoga in asthma management, and integrating Ayurveda with the modern medicine. Next one. Next one, sir. So, what is the asthma? The understanding of asthma is definition and overview is asthma is a chronic respiratory condition characterized by airway inflammation, bronchoconstriction, and symptoms like wheezing, coughing, and shortness of breath, impacting overall lung function. So, what are all the causes and risk factors as far as modern medicine is concerned? Asthma is triggered by allergens, air pollution, genetics, respiratory infections, lifestyle factors like smoking, increasing airway inflammation, and sensitivity. So what are all the symptoms and diagnosis? Asthma is a chronic respiratory condition marked by wheezing, coughing, shortness of breath. Diagnosis involves clinical evaluation, lung function test, and identifying the triggers. Next one, sir. So modern understanding of asthma pathophysiology, the chronic inflammation that is characterized by Th2 lymphocytes producing interleukins 3, 4, 5 and Tm. Then airway obstructions result from bronchoconstriction, mucus plugging, bronchial hyperresponsiveness, exaggerated bronchoconstrictive response to various stimuli mediated by increased smooth muscle mass. Then airway remodeling, long-term structural changes including subepithelial fibrosis, increased smooth muscles and angiogenesis. Key cellular components must will involve eosinophils, mast cells, T lymphocytes, neutrophils, and structural cells. Next one. Next one, sir. So what is the global burden of this asthma? The global prevalence is 339 million people worldwide affected by asthma, and mortality rate is around 4,61,000 deaths attributed to asthma annually. So what is the economic impact, including its cost of treatment and everything? That's more than $80 billion annual healthcare cost in US alone. Actually, these figures we have got from US itself, so that's what I am just presenting these figures from USA part. Key risk factors are genetic predispositions, family history increases risk 3 to 6x, environmental exposures, allergens, pollution, tobacco smoke, obesity, positive linear relationship with asthma prevalence, early life factors, prenatal exposure, birth weight, and respiratory infections. Next one. So in short, we can say that allergic, non-allergic exercise-induced asthma might be there. So asthma includes allergic, non-allergic exercise-induced asthma. Next one. So what are the conventional treatment approaches present now, so that people are getting the relief by using this modern medical sciences? That's inhalers. Next one, sir. Inhalers and bronchodilators. Inhalers deliver medication directly to the lungs, providing quick relief. Bronchodilators relax airway muscles, improving airflow and reducing asthmatic symptoms. Anti-inflammatory medications, primarily corticosteroids, reduce the airway inflammation and swelling, improving breathing and preventing asthmatic attacks. Emergency treatments for asthma includes rapid-acting inhaled bronchodilators, systemic corticosteroids to quickly relieve airway constrictions, inflammation, and preventing severe attacks and the respiratory failure. Next one. So what are the common drugs classification? Short-acting beta agonist. Bronchodilator quick relief for asthma symptoms. Side effects include the tremors, palpitations, headache, potential tolerance, and overuse. Second one, inhale corticosteroids, anti-inflammatory controls, reducing airway inflammation. Side effects include oral thrush, hoarseness, and potential adrenal suppression with the high doses. Long-acting beta agonist, maintenance bronchodilator providing extended symptom control. Side effects include cardiovascular symptoms, tremors, potential increased risk of severe exacerbation when used alone, and leukotriene modifiers. Oral controls blocking inflammatory mediators. Side effects include headache, gastrointestinal disturbances, and rare mucopsychiatric effect like mood changes. Next one. So what are all the adverse reactions of these particular drugs? Common short-term side effects are tremors, tachycardia, headaches, and nervousness. Long-term safety concerns are there. The prolonged use may lead to tolerance, cardiovascular issues, paradoxical bronchospasm, beta agonist specific reactions, which may cause tremors, hypokalemia, hyperglycemia, particularly when exceeding recommended doses, anticholinergic adverse effects, dry mouth, blurred vision, urinary retention, and increased intraocular pressure. Next one. So what are the corticosteroid related complications? That's the local side effects, oral thrush, dyspnea, cough can occur with inhaled corticosteroid. Systemic absorption risk, that long-term use may lead to adrenal suppression, growth retardation in children, and decreased bone mineral density. Metabolic complication can cause hyperglycemia, insulin resistance, and increased risk of developing diabetes, especially at the higher doses. Next one. Next one, sir. So what are the limitation and side effects of this conventional therapy? Long-term medication risk, use of conventional asthma medications can lead to side effects such as adrenal suppression, bone density loss, and increased risk of infections. Challenging asthma management, frequent use of conventional asthma treatments often leads to side effects like corticosteroid resistance, symptoms relapse, and patient non-compliance. That is the major cause. Next one. So after going through this, we can say that Ayurveda can contribute in the bronchial asthma. So what is the Ayurveda and its role in asthma? Next one. So what are the principles of Ayurveda? The concept of the three dosha is there. Ayurvedic view on the respiratory health and holistic approach to the disease. Ayurveda three dosha therapy includes the Vata, Pitta, and Kapha, represent bodily energies regulating the movement, metabolism, structure, respectively. Their balance is essential for the health and vital in understanding asthmatic management. Ayurveda views respiratory health as a balance of Vata, Kapha, dosha, emphasizing digestion, detoxification, herbal therapies to maintain the lung function and to prevent the asthma symptoms. And one more thing is the holistic approach to the disease. Ayurvedic holistic approach treats asthma by balancing body, mind, and spirit, emphasizing prevention, personalized therapies, and lifestyle changes to restore the overall harmony and the health. Next one. So classification of respiratory disease in Ayurveda. Ayurveda classifies respiratory disorders under the Pranava that is called as the respiratory system. Primarily involves Vata and Kapha imbalances and with specific conditions like Shwasa, Asthma and Kasa, that is the Kapha, representing distinct pathological types. So what is the cause of Shwasa Roga asthma according to the Ayurveda is the imbalance of Vata and Kapha doshas aggravated by factors like improper diet, seasonal changes, allergens, and lifestyle leading to the respiratory obstruction and breathing difficulties. Next one. So this is the basic concept of Ayurveda where we are just going through it and just treating the patient, the three dosha therapy and their role, that is Vata dosha, Pitta dosha, and Kapha dosha. Next one. So dosha imbalance and theory, that is the Vata dosha and asthma. Excess Vata can cause the dryness in respiratory channels, triggering asthma symptoms like wheezing, breathlessness through constrictions of bronchial tubes. Kapha dosha imbalance, aggravated kapha produces excess mucus in airways, leading to congestion, productive cough, and breathing difficulties, characteristic of asthmatic condition. And how the pitta is involved? That is, increased pitta can create inflammation respiratory tissues, exacerbating asthma through heat-induced bronchial irritation and hypersensitivity trigger factors. Next one. So classical definition of Charak Sahita is the Tamak Shwasa. The bronchial asthma is defined in Charak Sahita 1000 years back. That is the terminology is nothing but the Tamak Shwasa. That is the bronchial asthma. And the 5 types of Shwasa, that is the asthma, has been explained. Shudra Shwasa, Tamaka Shwasa, Chinna Shwasa, Urdu Shwasa, and Mahan Shwasa. Shudra Shwasa, mild breathlessness. Tamak Shwasa, bronchial asthma. Chinna Shwasa is the terminal respiratory conditions. And Urdu Shwasa, difficulty in inhaling. And Maha Shwasa, that is the severe terminal dyspnea. Doshic variants mostly involve, that's the Vata and Kapha. Key symptoms: wheezing, dyspnea worse at night, Kapha inability to lie down, sweating, anxiety, and preference for the heart atoms, already given by Charaka itself. Charaka just says that asthma is caused by aggravation of Vata and Kapha dosha. The condition begins with the stomach. Actually, here is the difference between Ayurveda and the allopathic medication. Ayurveda just saying that asthma is a start from the stomach itself. It can cause several factors which can leads to the respiratory conditions. Next one. So introduction to Ayurveda and respiratory health. The pranama strotasa, that pran can channel the life force throughout the body. Tamak shwasa, according to the asthma, characterized as a kapha vata imbalance disorder, and the panchamahabhuta that everyone knows. So here we can just correlate with modern scientific context. The modern research is validating many Ayurvedic principles through scientific investigation, revealing mechanism behind traditional practices, immunomodulation. Ayurvedic herbs demonstrate effect on cytokine pathways involved in the respiratory inflammation. Personalized medicine is there, that is called as a Prakruti medicine. Dosha specific approach aligns with the modern precision medicine tool. And psychoimmunology, Ayurvedic mind body connection reflects modern understanding of stress effects on the respiratory health. Next one. So Ayurvedic diagnosis and the treatment of asthma as far as Ayurveda is concerned. Next one, sir. So ancient diagnostic technique where practitioners assess pulse, that is called as Nadi Chikitsa and Nadi Pariksha in Ayurveda itself, where we are just taking the Nadi Pariksha. Ancient diagnostic technique where a practitioner uses pulse qualities to determine imbalance in doshas, particularly useful for the identify respiratory conditions like asthma. Then the tongue examination, that is called as the Jivha Pariksha, evaluating tongue color, coating, texture to identify respiratory disorders and assess the state of digestive fire affecting asthma symptoms. And third one is the visual, that is the Druk Pariksha, that is called as the direct watching the patient, observing physical characteristic, complexion, breathing patterns to determine the constitutional type, whether he is a Vatic type, Pitta type or Kapha type, and severity of asthmatic conditions. Next one. Next one, sir. Next one, sir. So here we have to add this particular thing in current medical scenario, that is the Ayurvedic treatment approaches. First one is the natural remedies. Ayurvedic drugs can reduce the asthma symptoms without pharmaceutical side effects and offering milder treatment options for some patients. The breathing techniques is also there. Methods like pranayama, yoga, breathing therapy can improve the lung function and reduce the reliance on medication that can cause unwanted side effects. And one more thing, that is the lifestyle modification, diet changes, allergen avoidance, and stress management techniques can decrease the asthma triggers, potentially reduce the need of for medications with the adverse effect. Next one. So herbal remedies mostly in asthmatic management. Next one, sir. So first one is the Vasa, Adatoda Vasika, Adulsa in Marathi itself. I don't know the South Indian name. That Vasa is very good drug in asthma itself. Vasa possesses bronchodilator and anti-inflammatory properties, effectively relieving respiratory spasms and reducing mucus, making it a key herb in the Ayurvedic asthmatic management. One more thing, that is the Tulsi. It is available in every Indian house. Tulsi possesses anti-inflammatory and bronchodilator properties, helping reduce asthmatic symptoms by calming airway inflammation and improving respiratory function in Ayurvedic treatments. And this drug, Pipali, that's long paper, it is widely available in South India itself. This Pipali is also known as bronchodilator and anti-inflammatory properties, helping to alleviate asthma symptoms by improving respiratory functions and reducing airway inflammation. Next one. So this is the Vasa plant, Adatoda Vasika. It is available in with our Ayurvedic College Institute. It's available in Herbal Garden. Next one. Tulsi. So it is almost everyone knows about it. Next one. Pipli, Piper longum. Next one. So how we can add some of the drugs again, that ancient herbs like Tulsi, ginger and licorice also can be used for centuries in Ayurveda to manage respiratory conditions, alleviate the asthmatic symptoms. And current winning drug is nothing but the turmeric. Turmeric, curcumin in turmeric possesses powerful anti-inflammatory properties that reduce the airway inflammation, improve the breathing when consumed regularly with the black pepper. Already we discussed the Vasaka itself. Next one. So evidence-based Ayurvedic herbs for the Ayurvedic management, asthmatic management. So first of all, that's a Vasa, potent bronchodilator and expectorant. Next one is the Pushkarmula, Inula racimosa. Actually, several articles are available for these drugs. As I think Puneet sir is knowing about nuclear factor kappa B pathway. This drug is acting on this particular pathway, which can produce relaxation of bronchioles, similar to adrenaline, but with longer lasting effect. Key component is even Padmapatradi Yogam. It is available all Ayurvedic pharmacies which are producing this drug in South India itself. St. Glycyrrhiza glabra, anti-inflammatory expectorant that soothes irritated mucous membranes and relieves bronchospasm. It is also adaptogenic and immune supporting. Pimply, immunomodulator with Panchan Rasa and Varmiria. Then Shirisha, Albizia lapex, strong anti-allergic property, effective for allergic asthma. Clinical study confirmed the reduced inflammatory cytokines and eosinophil counts. Next one. In traditional Asian medicine, Oroxylum indicum, that is called as Shonaka, has also longly used to cure and prevent variety of ailments, including diabetes, diarrhea, and respiratory disorders. Oroxylum indicum, this contains flavon oroxylin A because both these plants has been demonstrated to have anti-allergenic properties. The authors claim that in rat RBL2H3 mast cells and female bulb C mice to examine oroxylin A is likely to help the allergic asthma. This Shonaka, it is widely available in India itself. Next one. So this is the plant of Shonaka. It is also widely available. Then we need to move to towards some clinical studies which has been conducted by some of the authors. So this is the study by Shashidhar Dadamani et al. Clinical efficacy of Ayurvedic formulation. That's Kankasav. Kankasav is the very good drug, and it is available by all the Ayurvedic pharmacies throughout the India. I should not mention the name, but all reputed pharmacies are supplying this drug Kankasav and Trivruti Churna. It's a bronchial asthma. So in prospective open label multicentric trial, this drug has given a very good relief to the patients. Next one. So bronchodilator activity of Osimum sanctum, that is a Tulsi in mild and moderate asthmatic patients in comparison with the salbutamol, single blind crossover study. So in this study also, the author claims that the Tulsi is giving wonderful result for the bronchial asthma. Next one. One more thing, that's one pilot study on clinical efficacy of Solanum xanthocarpum and Solanum trilobactam on bronchial asthma. This is a weed like drug. It is available throughout the Maharashtra itself. Kantakari is the name, local name used by the all Ayurvedic doctors also. So the clinical efficacy is having very good efficacy of this drug on the bronchial asthma itself. Next one. So this is the Kantakari, that's Solanum xanthocarpum, is available with our institute, and it's just like a weed, but it is having very good result in asthma. Next one. For useful Ayurvedic drugs and one more herbal plants in bronchial asthma. For the treatment of asthma, number of Ayurvedic herbs and formulation has been investigated based on clinical trials. So first one is the Tylophora indica. These herbs improved the lung function symptom score, that's FEA1, and drug use according to systemic analysis many trials. Sore lips, nausea and stomach ache are some of the side effects. Picorazocura, that is called the Kutki, it is available in Arogyavardhani. That Arogyavardhani is also drug useful in bronchial asthma. This having antioxidant, immunomodulatory and spasmolytic properties having there. Then, one more thing, that is Solanum xanthocarpum. Already we have gone through it. That's even RCT. It in one study revealed no difference preliminary trials and it has found beneficial effects in the some of the patients. Next one. Boswellia serrata, the gum resin that demonstrated notable enhancement in lung function assessment, FEV1 relative to placebo in at least one study. Adhatoda vasica, already we have gone through it. Kankaso and Eladi gutica and Kantakare avlium. A clinical trial planned for around this much patients showed the combination as effective and as safe for treating mild and stable asthma. The trial demonstrated the notable enhancement in asthmatic control questionnaires. Next one. So some of the studies is also available on internet itself. The Padmapatradi Yoga clinical trial shows the significant improvement in peak expiratory flow rate and breath holding time. The dosha phenotypic study, whole system individualized Ayurvedic intervention and demonstrated significant improvement in FE1, FEC, FEVC and reduction in IgE and eosinophil levels. Cytokine modulations, Ayurvedic treatment shown to reduce the level of Th2 cytokines associated with asthmatic inflammation. And this is the Shwasavin Astalok trial 2017. Randomized control trial showed the efficacy as add-on therapy in mild to moderate persistent bronchial asthma. And some of the safety profile is also needed for all these drugs. Next one. So what is the advantages of Ayurvedic treatment part? That documented cases where the traditional Ayurvedic treatment significantly reduce the asthma symptoms and improve quality of life for patient resistance to conventional therapy. Clinical evidence showing how specific Ayurvedic herbal combination decrease frequency and severity of asthma attacks in documented patient cases. And one more master therapy is available with Ayurveda itself, that is a Panchakarma therapy. Cases studies demonstrating the respiratory functions improvement following comprehensive Panchakarma detoxification protocols can be used for the asthmatic patients. Next one. So, can we integrate the Ayurveda with the modern medicine? The answer is yes. Next one. So, complementary use of Ayurveda and allopathic treatments, benefits and challenges of integration. Integrated Ayurveda with the modern medicines, others holistic care, reduce the side effect but faces challenges like standardization issues, that is the drug standardization issues is there. Limited clinical trial data is available and the potential drug interactions is there. Some of the case studies and research evidence. Case studies reveal improved asthma control and reduce the medication dependence when Ayurveda complements allopathic treatment and supported by research demonstrating synergistic effects and enhance patient outcomes. Next one. So how the integrative medicine approach can be there? That's dosha specific treatment, multi-herbal formulation and whole body approach can be there. And evidence-based integration, tiered approach, maintaining conventional medication as foundation while introducing evidence-based complementary therapies, lifestyle modification, diet, stress management, breathing techniques, physical activity as adjunct to medication and safety monitoring, systemic assessment of herb drug interaction and documentation of complementary intervention. So this is in short for the clinical trials of Ayurvedic drugs. Recent study examines the Tulsi Vasa bronchodilation effect, mechanism of action of research. Scientific investigations reveal how Ayurvedic compounds affect inflammatory pathways and mast cell stabilization and bronchial smooth muscle relaxation in asthmatic patient. And comparative effectiveness studies. Research comparing traditional Ayurvedic formulation with conventional treatment demonstrate the complementary benefits when integrated into comprehensive asthma management protocols. Next one. Ayurveda also recommend the dietary recommendations, anti-inflammatory foods. So that's a turmeric can be added, ginger, cinnamon reduces the airway inflammations. These spices can contain those things which can inhibit the inflammatory responses triggered by allergens. Balancing doshas through diet, favor warm and light foods which pacify kapha while incorporating pungent and bitter herbs to improve breathing and reduce the congestion during asthma episode. And foods to avoid like dairy, cold foods and fermented foods which can increase the kapha dosha and worse asthma symptoms by producing excess mucus in the respiratory disorders. Next one. So pranayama and breathing techniques can be added, but this is a part of yoga. But here we can club the Ayurveda and yoga itself. Physiological benefits is the improves the respiratory muscle strength, increase vital capacity, reduces the airway hyperresponsiveness, and enhance oxygen utilization. And psychological benefits reduces the stress, anxiety, improves parasympathetic tone, and provides tools for managing acute symptoms. So some of the pranayama has been recommended by the people. Most of these Brahmari pranayama, humming exhalation creates the internal vibration that relaxes airways and reduces the bronchospasm during mild attacks. Next one. So this thing already we discussed, pranayama for asthma and asanas. Several asanas has been given by the yoga itself. Next one. So what is the importance if we go through the lifestyle modifications? The smoke is the crucial factor in asthma itself. Lifestyle changes, yoga enhances the respiratory health, and daily routine for Dincharya. This Dincharya, we have several chapters already explained in the ancient text, and Dincharya is having very much importance. If we see the modern life itself, because people don't have just timing for the food, eating, and sleep things. Everyone, we know that we are just working under stressful conditions. So Ayurveda has given some Dincharya, that diurnal variations is very important. Incorporating Dincharya promotes the respiratory health by encouraging regular breathing exercises, balanced meals, proper sleep, stress reduction, which can collectively support asthma management and enhance the lung function. Next one. So what can be advice for the current integrated approach? That's the stage protocol should be there. Differentiate between the acute management, bronchodilators, steroids, and chronic care, preventive herbs and pranayama, lifestyle modification, personalized dosing, tailored treatments to individual dosha, constitution, vat, pitta, kapha, disease severity based on the both symptoms assessment and pulmonary function test, lifestyle integration, dietary recommendation, daily routine, sleep hygiene, stress management, monitoring protocol, regular assessment and symptom control, lung function, quality of life metrics, and potential herb drug interactions. Next one. So what is the conclusion and future direction? Integrating Ayurveda with modern medicine, integration of knowledge system. Modern medicine provides precise diagnostic tool, while Ayurveda offers personalized treatment based on constitutional type. Evidence-based approach should be there. Growing scientific validation for Ayurvedic herbs and pranayama in managing asthma through bronchodilation and anti-inflammatory actions. Patient-centered care should be there. Dosha-specific treatments addresses the individual variation in disease presentation and response to the therapy. Future research should be needed. Standardized clinical trial should be there. Some protocols can be designed. Biomarker identification and mechanistic studies to validate traditional knowledge. And healthcare implementation should be there. Development of integrated clinical protocols. Practitioner education and collaborative practice model should be there. So this is the time to call to action, collaborate across healthcare disciplines to develop comprehensive protocol that levers the strengths of both medical system for optimal patient outcomes. Next one, sir. So what is the future perspective in asthma management? The potential of holistic patient care models. Combining Ayurveda and modern medicine can enhance the holistic asthma care by addressing physical, mental, and environmental factors, improving patient outcome through personalized and integrated treatment models. And research trend in Ayurveda asthma management. The emerging studies highlight synergistic effect of combining Ayurvedic herbs with modern drugs. Emphasizing personalized treatments reduces side effects and enhance the respiratory function in asthma management. So if we add Ayurveda with the allopathic itself, so what we can get, that's a safe and natural drugs, lesser side effects. Cost is the very important factor for current this medical things. Then the easily available drugs are there. Lesser R&D cost can be offered by the company itself, and easy combinations are available. It can provide the better combinations. Future insight is needed on this topic. Collaborative research can be promoted, and it is already invited. Drugs are palatable. Most of the times these drugs are just getting infamous due to some things that this koata kada the people don't take it. It should not be like that. You have to take these drugs. Then these Ayurvedic herbs can be act as a micronutrients. So some studies are also are conducted by the several researcher. Next one. So in nutshell, we can say that safe medication without side effect is need of our. Ayurvedic drugs are well efficacious in asthma, having better safety than allopathic drugs. Ayurveda can provide better combination in asthma with minimal side effects. Again, we can say future insight is needed and collaborative work can be promoted. So this is the presentation which I would like to share with all of you. So thank you very much, Murthy sir, for giving me a chance for this presentation and sharing my thoughts. Thank you very much, sir, and Varun sir also.
Thank you very much, sir. It was indeed a very good presentation where you covered the modern aspects as well as the Ayurvedic aspects. We have one question from the audience who says, "Do I, Raghavendra Verma, Ayurvedic medicine has no side effects on allopathic?"
Fortunately, it is not found like that, sir. But the thing is that actually our all the Ayurvedic Council have started this pharmacovigilance things itself, and already the text has already explained this side effect also. But most of the times we don't find that side effect, sir. So that is the plus point of these drugs.
Uh, any questions in the audience? Please raise your hand.
So any participant,
So one more
please.
Prabhakar Patil says, are there any drug interactions between Ayurvedic medicine and modern medicine?
Already I have gone through that topic also, sir. But again, the thing is that that kind of the research is needed to see the interactions of Ayurvedic drugs and modern drugs. But fortunate is that we are getting good results in the patients itself by using both of the therapies.
So in your center, do you have integrated center, sir, or is it purely Ayurvedic?
No, the problem is that, sir, actually we have two flows now. One flow is from Ayurveda part itself. That those who are believe that we don't need allopathy itself. But I believe on integration because we have to go with for the betterment of the patients. If the
Correct,
patient
correct,
is suffering in emergency condition, we should go with the allopathic itself. We should stabilize the patient and we can start Ayurveda itself.
correct, correct.
Hmm.
So you have any experience of running integrated clinics?
Not that much, sir, but I have some case studies and the results are wonderful.
Sir, what about I had a basic doubt. We know that Ayurveda usually preparations are a combination of herbs. I
Hmm.
think in your presentation you're talking about individual herbs. So can you also highlight a few of the popular combinations?
So, no, sir, if we go through Ayurvedic test now, we have more than 1000 combinations available in Ayurveda itself. For today's presentation, I just curtail only for the few herbs only. We have a
Mhm.
number of polyherbal herbs are there, bhasmas are there, and in Chennai part itself, they have some Siddha medicine. So they are also preparing wonderful bhasmas, especially Abraga bhasma. But the problem is that if we say the bhasma, people having some problem with bhasma that they are just saying that it can cause heavy metals and nephrotoxicity is there. But the fortunate again thing is that we never found such nephrotoxicity in patient and we are getting wonderful result.
I think an audience has a question. Prabhakar Patil, I'm just watching the patient. How can we diagnose that? I just want to answer this because sir has very clearly said that there are three aspects of Ayurveda through which they diagnose. So it is not only by watching, it also by the tongue as well as the punch. So it is not just one element. So of course, inspection has been a common methodology in any medical practice. So anything you want to add, sir?
Yeah, sir. Because now the thing is that today's presentation, I would like to make some to understand the people actually. But the problem is with the other people, no, other pathy people. Ayurveda is having three Vidya Pariksha. That three types of examinations are there. To Ashtavidya Pariksha, Dashavidya Pariksha. That the 10 types of parikshas are there. So if you go for the Ayurveda, you have to understand 10 types of examination. Then you can make the diagnosis. But here, some of the things which are available in society itself, that's what I made. So only three things only.
One more thing, you were telling Anatoda Vasika is one of the herbs used for asthma. But
Mhm.
what I have observed is it is also a weed. I think it's a weed which is usually causing allergy. So
Sorry, sir.
it causes allergy.
Allergy.
Yeah. So do you
Uh,
suggest these patients should undergo an allergy testing before they start an Ayurveda therapy? Is there something like that?
uh, the thing is that, no, sir, actually, for my kid already I have gone through it actually. We did allergic testing, but it has no evidence. But when we started the combination therapy, we got wonderful result.
So most of the drugs used in asthma in Ayurveda can be used without allergy.
Sorry,
So as per your
the sound is breaking, sir.
suggestion, most of the Ayurveda drugs can be used in asthma patients without testing.
No, already see the problem is with allopathic medications, sir. They are just asking the evidence and evidence. But this is the regular practice for all Ayurvedic people since 2000 years, sir. We are just using the drugs by mentioning, which is mentioned in the Ayurvedic text itself, and which has been explained by the Ayurvedic principle itself.
No, the
So the part
question
of
is
allergy.
actually, I think, sir, I think let me interrupt, sir. Dr.
Uh-huh.
Puneet's question is that some of the, like as you mentioned, Azotoda Osaka, it produces the allergic reaction. I think he
No,
has
no.
seen some experiences.
Yeah. Already, sir,
So
I have.
the question is there any, allergic test to be done before initiating these
No, sir.
drugs?
Such studies have not been there. Yeah, yeah. So studies not there.
No, no, not the study. According to your experience, did you also see any allergic reactions to
No,
the
sir.
patient?
Fortunately, already I explained. I have not seen such things, but
Okay.
I have added there because we should not say that Ayurvedic drugs को कोई side effect नहीं होता. We should not claim like that. No, it just it just shows that we are non-scientific people. That's why I added.
No. Thing is that any drug, for that matter, drug means any drug which can alter the disease process or physiological process. So if
Right,
it
right.
is having intrinsic activity, I'm sure at least somewhere it will cause some allergic reactions or some kind of adverse drug reaction. So
Yeah.
this is maybe it is not detected, but
Yeah, it
as you
might not
rightly
be
said,
detected or
sometimes
sometimes
it may be
people
mild.
don't
It
compliment.
will
Yeah,
automatically resolve also.
yeah, yeah.
Yes, sir. Dr. Puneet, please go ahead.
Hello.
Yes, sir.
Sir,
Sir, actually, I
in
want.
one of your slide, you had mentioned Ayurvedic preparations has improved FE1. So, FE1 is spirometry.
Sorry, sir. Spirometry.
Yeah, spirometry. You have mentioned few of the herbs have improved the FE1 function.
Sir, so your sound is breaking, sir. Sorry. Please repeat the question.
You had mentioned in one of your slides that some studies have shown improvement in FE1.
Yeah, yeah, yeah. I have collected that paper, sir. Actually, I need to go through detail in that, actually.
Mm. And also,
Hello,
Hello.
Dr. Puneet.
introduction, I told about nebulization.
Hello.
Yeah, Dr. Puneet. Your voice is breaking. Hello. Hello, Dr. Puneet.
Sir, any nebulization preparation? Hello. Sir,
No, sir.
any common nebulization preparation in Ayurveda that can be used?
Nebulization preparation, we should not say, but some Swedan therapies is there, sir. It is actually included in that Panchakarma therapy. But the problem is with this therapy is that we can say that hygiene thing is mostly coming is there. So I don't recommend that.
Okay, okay.
Hmm.
Okay, sir. Thank you very much. Thank you.
Okay, thank you very much, sir.
Okay,
Thank you.
someone wanted to ask question. Dr. Prabhakar Patil.
Yes, sir. Same
We
thing
can.
I wanted to ask that whether any nebulization or metered dose inhaler type things they're available with the Ayurvedic things. So already I think sir answered that. Sir,
No,
any
actually,
severe side
sir,
effects are there with
I
Ayurvedic preparations? Severe side effects where we should be cautious while using those drugs.
No, sir. You can search. You can search such study. Unfortunately, it is not there. But the problem is with current medical things with Ayurveda, that we need to fix the doses of our own therapies, sir. Because some of the doctors are giving 1 gram, some of the doctors are giving 2 gram. That is the key thing.
That means it is related to posology, means drug, how much dose should be there, should be
Yeah,
given.
that kind of a
So,
study we need.
yeah, means sir, suppose if you want to combine like bronchodilators with Ayurvedic medicines,
Mhm.
so how it can be combined, or whether we have to give it separately for the treatment? What is the thing means you suggest, sir?
See, actually, for my kid, now what I did actually, that Foracort is available. I think the budesonide is there, na? So
Yeah.
that inhalation we have started, and we have started this Ayurvedic that Adha Thoda Vasika, that Vasavale of Sandu company. That it has given wonderful result. No relapse is there. My patient, that my kid is having this stable conditions.
Actually, there is one Haripriya, Dr. Haripriya, I believe. Haripriya, can you please explain your study results?
Hello, sir. Good evening.
Yeah. Please
So
go ahead.
currently, I'm pursuing my post-graduation, and I had come up on a paper where they have done a study with nebulization using Dolpa 3 weeks, sir, in SUM College of Ayurveda, Hassan, and it had shown excellent results in bronchial asthma, sir.
How you prepare the formula? Is it with aerosol preparation?
Yes, sir. We have taken the extract of those Dolpa 3 weeks.
Yeah. You
And,
mentioned something there. But what my
yes.
question is that, have you prepared the aerosol preparation?
So it's not me who has conducted the study. So I had gone through one paper, so that's how I got
Okay.
it.
Okay.
Can you be loud a little bit?
We need multi-centric trial in such conditions, sir.
Yes, sir. Yes, it was just a postgraduate thesis study. So further validation has to be done, sir.
You can make patent of it, madam, because nebulization, that things very less is available in Ayurveda itself for this asthmatic conditions.
Yes, sir. Yes.
Okay.
Thank you.
So,
Thank you, sir.
there was one question: what is the role of Ayurveda in stroke and ICU patients? Since the scope of today's discussion is only on asthma, I think better not to discuss some other things. So some other subject, because it will only inconvenience the total program. Is there any further questions? If any questions are there, if no further questions are there, I would like to thank Dr. Prashant sir for giving the nice talk. Definitely, we learned definitely few points better. I was definitely not at all aware of Ayurvedic medicines. I'm completely, blank about whatever this Ayurvedic medicines in asthma. I keep hearing, especially this tulsi leaves, and I keep hearing about it, but I never had any much understanding about it. Thank you so much for giving us. Being a pharmacologist, it is important for us to learn anything and everything that is available, and mechanisms that can be adopted for betterment of patients' life. And with this, I would like to thank you for volunteering again and taking part in this webinar program. And so we really appreciate you for your contribution. And now I would like to appreciate both our chairperson and speaker with the certificate. So let me just share the screen so that it is visible for others also. So this is the certificate to Dr. Prashant sir. Thank you so much for taking part in this program. and being part of our MPS webinars. And we have crossed more than 5,000 registrations since last 50 months. We have been conducting series of programs, and thank you everyone for joining us and supporting our program. And maybe you may be wondering, why should I attend all these MPS programs and collect certificates and all? I would like to say that we will be coming up with MPS fellowships very soon, and there will be requirement of minimum of 50 hours of participation in training programs conducted by MPS. So these certificates will be valued when if you are applying for the fellowships in the future. Next one is, I would like to thank Dr. Puneet for joining us. You are a busy practitioner, and thank you so much for sparing your time. And especially as you mentioned, it is a Monday, and you will have a lot of patients waiting for you. So thank you for accepting our invitation and being part of our program. I'll be sending through or email these certificates to both of you. And I will also create a portal for distributing these certificates to all the participants. So in that way, all of you can, certify yourself for joining this program by providing the, feedback on the program. And this whole program is recorded, and it is also directly relayed in the YouTube channel of MPS Society also. In that way, you can even view this program even at your leisure also. So please feel free to attend and then gain more knowledge, and you can attend repeatedly so that some of these concepts what we are hearing today first time may not get into our brain, and if we keep on learning again and again, and most probably we'll come up with some research programs together, or maybe jointly or alone, and in future most probably we will adopt some parts of this. And as you said that, I think Dr. Puneet is an expert in allergy and asthma. So I would like to request him for the closing remark, if any. Dr. Puneet.
As nicely presented by our speaker, I would just summarize the points. As he said, definitely asthma is a stable phase and an emergency phase because it's the nature of the disease itself. So we should be aware that whenever a patient is in emergency, we should not hesitate to get into the allopathic management methods. Of course, there are various guidelines given by allopathic medicine. The most widely accepted is the GINA guidelines, which also says there is a maintenance and the phase and as well as the phase where we use for rescue. So even in those guidelines, they would not suggest continuous usage of it because of its long-term dose drug reactions. In these situations, I would definitely vouch for what Dr. Prashant sir had said. We can use certain Ayurvedic preparations, but I think since Ayurveda preparations, as he said, it's over a period of 2,000 years, it has evolved, and the herbs have been identified. But as I said, there are over 1,000 formulations which we don't have in allopathy also. Allopathic medicine probably would have developed a few of the formulations in the last 100 years, including immunotherapy and some of the biologics, which is not even time tested. It might have some evidence, but as Ayurveda says, it is the experience with which they have used. So those days was not the era of evidence-based medicine, but of course it was the knowledge and the experience each of the Ayurveda physician had. which has made and developed into the text, Ayurveda text. So it has traditionally been passed from one Ayurveda physician to another physician. So it also has a different kind of evidence. We need to value those experiences which has been documented, which may not be accepted by allopathic system of medicine. But that kind of research, allopathic kind of research, demands a lot of funding. We are also aware, even when we are taking up a new drug or anything, this budget is such an important thing. So having these things, sure, the current government also emphasizes on research in Ayurveda and other streams of medicine. I think we should make use of such opportunities, and more research can also be is being done. And I wish more integrated research should be explored. So this is the way we can promote our own system of medicine, where we have embraced the Western medicine because of its evidence. So I'm sure in future we would have many opportunities where the MPS society itself can explore what ways we can do research in terms of new preparations, new drugs in Ayurveda, new formulations, where Ayurvedic preparations can have also some evidence-based medicine. With this, I would like to conclude.
Yeah, thank you. Dr. Puneet, I would like to say that, like if we can open a, registry, I would say, registry of, the patients treated with Ayurvedic medicine and what are the results and all, like how, like if we can have a kind of, online registry where people voluntarily, they can keep on feeding the data and at some point of time, if we are able to assess that, how many patients were treated, how long patient got got treatment, and what are the results of it, and what is the outcome, and how much time patient took the time to result. Because what I'm saying is we can't do the clinical trials, we can't do the we can't spend money, but when the treatment is happening already, if we can register the patients like a registry and keep on doing that maybe for 1 year, 2 years, 3 years. After that, if we analyze again, I mean, which treatment, which medicine or which herb provided better care, so we can keep on grading, so that once we grade the based on the evidence of, even though we will not have a standardized method of evaluation, but we will be able to arrive at some conclusion. So if we can initiate this way, and I'm sure, like by using the clinical material which is already coming on our way, and analyze them, and we will be able to, like the way how we are doing pharmacovigilance. Pharmacovigilance is a open science. You keep on accumulating the data, and at some point of time, you analyze, reanalyze, keep on reanalyzing. You will be able to come up with some kind of signals and all. So similarly, I think Indian medicine also can be assessed with the help of ongoing treatment and maintaining the registries. And I'm sure if all of you agree, we can very well write a like multi-site, multi-investigator kind of some protocol to write the patient histories and registry, enter their case details and all. We can take some central ethics committee details and approvals, and because there is no harm in managing, means maintaining the patient outcome, patient treatment details, and patient signs and symptoms, clinical presentation, and what is the duration of hospitalization, what is the duration of treatment, what is the relapses, or what are the outcomes of it, the treatment. So like this, if we analyze the data at some point of time, and I'm sure we will be able to confirm among the available treatment which is the best one, among the Ayurvedic treatments, which is the best one, which is the first one to be, offering the best relief, which is the second one, which is the third one, which is the fourth one, like this, on the preference. And also there can be geographic area preferences also, because geographical area plays a very important role as far as the temperature, dryness, inflammation, dust availability, vata, pitta, kapha, whatever you have mentioned. All these will change based on the geographical area also. So according to that also, we should be able to identify which is the best treatment in Tamil Nadu, which is the best treatment in Karnataka, which is the best treatment in Kerala, which is best in Delhi. Like that, we should be able to come up with better understanding about the treatments available. So MPS definitely will be able to support this kind of thing, and we require some collaboration, and we will be able to do it. So any comments from both of you?
The suggestion is really wonderful, sir. It's a very novel idea. I would like to hear from Prashant, sir. Anything you want to add?
Yes, sir. Actually, you rightly said by the sir that we need to make some collaboration. We need to make some the protocol should be there, and we need to add this pharmacovigilance thing also, sir. So that, and one more thing I would like to add here is that side effect for some instance we can keep aside, but we need to treat the patient by using Ayurvedic drugs, sir. That initiative is needed now.
Yes, that's
That
what I
initiative
meant
is needed.
actually. Like treatment, like especially Ayurvedic physicians who are using the treatment, who are already giving the treatment, we just have to follow them, and we just keep on understanding how the patient is doing, or what are the difficulties that because we being the allopathic physicians, we will not be able to use them as it is without the Ayurvedic physicians, because we don't have any understanding of Ayurvedic drugs. So without the Ayurvedic physicians, we will not be able to do anything. And if you are able to help us to go through this process, and I'm sure we will be able to do wonders.
If there is any possibilities in collaboration, let me know, sir.
Yes. Okay. Thank you.
Very much,
Thank
sir.
you. Thank you everyone for giving the your time and knowledge, and all the support for conducting this webinar successfully. We have exactly reached the 7 p.m. and I think we can end if no further questions are there. So have a good day, good night, and looking forward to see you all in our next program. Thank you so much.
Thank you.
Thank you, Dr. Puneet.
Thank you, sir.
Thank you.